Institute in Liberal Democracies. She has taught a wide array of courses for the philosophy department, including medical ethics, utilitarianism, and Aristotle's moral theory. She's now an affiliated scholar with the Wheatley Institution, and in April 2018 gave one of the semi-annual Reason for Hope conference lectures. Dr. Faulconer's research interests are in moral and political philosophy and their intersection in applied settings, particularly medical ethics, as you will have imagined based on the topic of her presentation today. She specializes in questions regarding physician-assisted suicide, the morality of the human germline, genome editing, the distribution of scarce resources in medicine, including the ethics of compensation for bodily goods, such as human eggs, blood, and kidneys. I think we'll hear more about that today. She and her husband, Matthew, are the parents of 3 children. So I think you're probably familiar with the procedure. We'll turn the time over to Dr. Faulconer. There will be some time for an opportunity, I believe, for participation and questions, and we'll wrap up by 11:50. Having said that, I'm pleased to introduce to you Dr. Faulconer.
Okay, so what I'm planning today is a little less on the lecture side, more on the discussion side. Your participation and comments are encouraged. And I just want to point out, I gave a lecture presentation on a similar topic for the philosophy lecture series a few years ago. I learned from that. I'm still learning. This is very much some thinking in progress. I know in fact, here he is, Joe Dumar, who's in my Philosophy 300 class right now. The other day after class, he asked, do you ever learn anything about these things? And my response would be, every time I have a discussion like this, I learn things. We all have our own points of view and experiences, and I think it's really tremendously helpful in working through these things. One thing I often mention to my medical ethics classes is these subjects can be sensitive. There's scope for offending people. It's never my intent to offend someone. Let's all try to teach and learn from each other and be gentle with each other. Anyway, today, as you've probably guessed, my topic is what kind of bodily goods and services is it okay to give away as a gift? Can you give it as a gift but still get compensation? Or, should it be just not a gift really, but whatever the market will bear? Now, these topics are often talked about in the literature. Kim Krawiec, she's a law professor at Duke who has written about these things extensively. She calls these taboo trades. George Roth calls them repugnant transactions. A lot of people talk about these issues under the label of commodification, but there's so much more to say about it. Anyway, today we're just going to be dipping our toes in the water because all of these things could be talked about at a lot more length than we're going to have time for today. But first of all, just in terms of bodily goods, I made a list. There are probably things that aren't on this list, but this is a lot of them. You can also, I guess, 2 things I think of that I didn't put up here. You can rent out your skin. You can have a corporation pay for you to display their logo. You'll get more money if you're famous, so your skin may not be worth quite as much. And then, also, of course, you can be a research subject. You can participate in medical trials. That's a service I didn't put up here. So these are things that are all given away. Often many of these things are sold. Some of them aren't sold. So one thing we need to talk about, first of all, is, of course, you're all familiar that the legal and the moral are not the same, right? The legal and the moral are not the same. So one thing we have to do when thinking about these topics is first kind of look at what is the status quo, like what is legal today. We also need to think about what is moral, which might be really different than the status quo or slightly different. Since it's BYU, where possible, we always want to say, well, what is our prophet, what have our apostles said about this? So church positions. And then, of course, finally, how do we think it should be? If we start off by talking about the status quo, are there things that ought to change? And that's kind of where I started on this topic because I was surprised to find that my intuitions were different than the status quo but in clashing ways, and I'm still looking for kind of the grand theory that explains why things are the way they are, or why they should be different. So, but just to get into that, let's start talking about these and the status quo. Can you sell your hair? Yes, you can, and people do. Breast milk. Can you sell breast milk? Is it legal?
Yes.
Yes. The going rate is $1 an ounce. Semen? Can you sell your semen? Yes. You get more than $50 a donation, but it has to be acceptable. If it doesn't meet the right number of semen, if your semen aren't the right motility, they'll reject it and you get nothing for the same amount of work, which is an important point we'll talk about later. So blood in the United States, what's true of blood? Yeah, blood is a little tricky, and I have to say in the United States, because as with many of these questions, it differs across the world. Our position on blood and some blood products like plasma, platelets, these things are handled quite differently by different countries. I mean, notably countries that are more similar to us, like Canada and Great Britain, it's very interesting to see how they handle these issues. So in the United States, you can go and donate your blood for free, of course. And if you get on the donor list, they will send you offers. You know, you can get a $5 Amazon gift card. So is that payment, or is it just compensation, or is it just not really compensation for your time, but just a little gift, a little incentive? Of course, plasma right now is handled differently than blood. It's sold, although still we often hear the language of compensation, that it's not really that you're selling your plasma, but you're being compensated for your effort in donating it. Bone marrow, can you sell your bone marrow? Yes. So it's difficult to sell your bone marrow because you have to have an HLA tissue match. This is pretty tricky, so your chances of being able to sell your bone marrow are 1 in 534. So it's not really as easy to sign up, whereas if you want to give someone your hair, you know, you just have to grow your hair long enough. With bone marrow, it depends on your ethnicity. It really depends on ethnicity a lot. There's a big drive to get people of ethnicities other than white into the donor database because there's such a strong need for bone marrow of people from other backgrounds. There's a real problem with people from other backgrounds not getting the bone marrow they need. You're more likely to find a match if you're Caucasian. All right, eggs. Can you sell your eggs? Yeah. Now, again, here's a case where we want to say, well, what exactly are you selling there? You know, because with hair, it's pretty straightforward. You're actually selling the hair, not the time you spent growing it. With breast milk, it's a little fuzzy. I mean, maybe you're selling the time and difficulty of obtaining it. I don't know who has tried expressing breast milk in this class. I have. I thought it was really hard. If I was doing it for a job, it would be way more than $1 an ounce. But for some people, it's easier. And so this is a bit of a tangent, but they're babies that really need breast milk and mothers who can't give it to them. So semen, I said already, that's a tricky area. Well, actually, no, it's not tricky because, as I said, if you go in to donate your semen and your sample doesn't meet their requirements, it's rejected, you get nothing. And so one thing that I thought was interesting that I learned about as I studied this is only a segment of the population. It turns out it's like bone marrow in this way, and that not everyone can donate their semen. Now, we already know, okay, the women in the room, you're not going to be donating your semen, obvious. But I mean, of the men, a lot of you would not meet their requirements. And of those of you who would meet their requirements, even if you became accepted as a regular donor, about 50% of your samples would not be compensated because they just wouldn't meet the standards. You have to sleep right, you have to eat right. It's actually, people who are serious about donating semen actually have a regimen for trying to make sure that their samples are accepted. So I'd say in the case of semen, it's pretty obvious. Although someone may try to say you're being compensated for your time, you're actually being compensated for your sperm. This is also true of eggs. Until recently, this was a super fuzzy one because the gift language is used really differently between semen and eggs. And part of that is the process is pretty different. It's pretty easy to donate semen. It's pretty difficult to donate eggs. You have to be unconscious. It's a surgery, whereas men can donate 3 times a week if they're really fit for that. So with eggs, the language that donation clinics have used is that this is a gift, and they've really emphasized the idea that this is something you're doing for an infertile couple, whereas for semen donors, they tend to explain it as a job, like this is just something you come in and do, and you're done, and you get your money and you go. To encourage women to donate, often there's really been this emphasis on, how you want to help people. However, there was a big lawsuit because people said, actually, there's an oocyte cartel. They're fixing the price of eggs. And they were. They were limiting the amount of money that would be paid for eggs because they said, well, it should be a gift. But interestingly, many of the clinics that deal in eggs, they don't give the eggs they harvest as a gift. It was a for-profit making venture. So a number of women got together and sued saying, no, we should be compensated according to the market for the worth of our eggs. So what this means is, although in the past you could say that it was compensation for the pain and the risk of the surgery and the time involved and the injections that you have to do, now it's become much more like semen, and that women are compensated more if they donate more eggs and less if they donate fewer eggs. And possibly you can get just a very minimal payment if your eggs aren't satisfactory. So it's much more like semen that way. It's become more obvious. No, we're not just paying for you for your time and effort, pain involved, the risk. You're actually, because you make more if you have more eggs and less if you're able to donate fewer eggs, you're actually paid for your eggs. Kidneys. Can you donate a kidney?
Yeah.
Can you give it away? Can you be paid for it? In the United States, no. You cannot be paid for your kidney. How about other countries in the world? Can you be paid for your kidney? There is a place where you can be paid for your kidney. There's only one country. Do you know what it is?
Iran.
Yes. Iran is the only country in the world where you can be paid for your kidney. Another interesting fact about Iran, it's the only nation in the world that doesn't have a waiting list for kidneys. So we have, to jump ahead just a little, we have this question over here. So I have U, V, and D. Now this is horribly simplistic, and this is why you need to go take Professor Graham's Aristotle class, and you need to go and take Professor Mauer's Virtue Ethics class, and you've got to take Dr. Jensen's Kant class. It's horribly simplistic, but I'd say a question we get from utilitarianism that applies to this subject is, does it relieve suffering? And of course, many of these things are bought and sold because, in fact, people want them, and there is great suffering. I mean, we could tell jokes about people who are bald and they're suffering needing hair, but it's a real thing. People want to have hair. Babies, I already said, premature infants often need breast milk really badly and can't get it. It makes a big difference in their health outcomes. So yeah, there's suffering that giving or selling breast milk provides. So we'll put semen and eggs together. Oh, one we could definitely put on the list that I didn't put here, embryos. You could give away an embryo that you have as a result of in vitro fertilization. If you're pursuing in vitro fertilization, they want to maximize the number of fertilized of embryos. They want to maximize the number of embryos you get to increase your chances of success, because not every round of in vitro fertilization is successful. But what this means is lots of people end up with extras. The current advice is to implant only a single embryo because health outcomes are poor with multiple births. Bad things happen. We all know healthy twins and triplets, but bad things happen in cases of multiple births. So best practice, they say, is to implant only a single embryo. Well, if you turn out to be someone who produces more than 20 eggs and has 10 viable embryos in preparing for IVF, you may be aware that you're never going to use all of the embryos that you have. So, what do you do with them? Do you put them on ice and freeze them indefinitely? A lot of people feel like that's easier than making the other decisions, but now the cryobanks are charging for the freezing, sometimes $300 to $400 a month. So although you may feel better about not destroying the embryos, it's going to cost you. Of course, the other option is destroying them. A nicer word is allowing them to expire. You can also donate them for research, so we can learn more about infertility and how embryos develop. Or you can offer your embryo for a sort of embryo adoption for an infertile couple that's not able to produce their own embryos. So we'll put embryos and eggs and semen all in the same category. The type of suffering they relieve is infertility. Now, how big of a deal is infertility? You say very. I agree with you. Can anybody quantify it? Is it very common? Let's see. I always have to pause because I always want to ask for a raise of hands, but given what I talk about, it's sometimes risky. I think a safe question is, do you know anyone whose life has been affected by infertility? Yeah, today infertility affects 1 in 10 couples, and the number is growing for reasons we don't fully understand. Especially men's sperm counts are becoming lower than they have been in the past, and so infertility is a growing problem. And if we counted off in here, what are there in here? 30 people, 40 people?
Yeah, 25 students.
So 25 students and a few extras. So we could say today, probably, 3 of you will experience infertility. Since the days of the Old Testament, this has been a really big deal for people, right? I mean, we remember Sarah, Abraham's wife. We remember Hannah. And those stories are in the past, but I think they mirror people's experiences today. In the Bible, it's always the women who seem to suffer from infertility. We know now that it's a male and a female problem. Male factors contribute about 40% of infertility. And today, we know that men often want babies just as much as women, so it's a big deal for men and women. And I think nothing I say about these topics should be thought to indicate that I don't think infertility is a really serious problem and a way that people suffer. And when we mourn with those who mourn, I think that's one of the things we need to put in that category. It's a hard thing. Going down the list, okay, so we said you can give away your kidney, but unless you're in Iran, you can't sell it. There's also liver lobes. This is even more difficult than kidneys, because although you have 2 kidneys and you can get by just fine with only one, donating part of your liver is a bigger deal. It's a much riskier surgery, and health outcomes are likely to be worse. So giving away a liver lobe is still quite rare. A lot of people have questions about whether it's ethical. There are cases of parents donating to their children. It's not super common for a living donor to donate part of their liver, although we could see as technology develops, it could become more common. And of course, as technology develops, we hope that many of these things will have substitutes. So we're not looking for a living donor kidney, but we have some other way of getting it. For a long time, we've hoped that we could harvest enough kidneys and things from dead donors to meet the demand, because we know every day 14 people die waiting for a kidney. In 2014, there were, I think I wrote it down. No? Oh, yes. Okay, so every 14 minutes someone is added to the kidney transplant list because of the obesity problem in the United States. That number has ballooned. In 2014, 4,761 people died waiting for a kidney on the list, and 3,668 people became too sick to stay on the list. They weren't eligible for a kidney at that point. And so we've hoped that through public information campaigns and trying to get everyone to put on their driver's license, yes, I'm willing to be a donor. That applies to if you're in an accident and you're dead. We've hoped that we can get more kidneys that way, and there has been some headway, but still the dead donors can't meet the demand. And especially as our automobile safety has improved, fewer people die in the way that you need to die, in a way that, say, puts you brain dead, but they're still have you hooked up to machines and are maintaining your organs so they can take that organ in a very fresh state and implant it in someone else. Fewer people are dying in that particular way. So you're dead, but you're not eligible to donate your organs because they're not useful. So what this means is a lot of people have looked at the living donors as a possible solution for this problem. As we look at Iran and say, well, there's one place that allows the sale of kidneys, and there's one place that doesn't have a list. Should we do that too? But then we have to look at our question. So this question, does it relieve suffering? For sure, kidneys relieve suffering because dialysis takes 12 hours a week. You can't work, you feel tired, you have to eat a special diet. It's not awesome. Also, your life expectancy is not very good. So does it relieve suffering? Of course it does, yes. Definitely it relieves suffering. But let's go to this question. So, is it still altruism if there's compensation? Okay, so what does it mean if I give away a kidney and I get paid or compensated for that somehow? So here, I put this as a question from virtue ethics. I'm sure some of these questions could be asked by, does it relieve suffering could be asked by someone other than a utilitarian, of course. And I'm sure someone other than a virtue ethicist could ask the question about altruism. But if we go back to Aristotle and we say, well, what does the virtuous person do in this situation? What does a person of moral excellence, that morally excellent person, is it still morally excellent? Is it virtuous? Are you a virtuous person if someone pays you for your kidney? Altruistic donors, if we define that pretty narrowly, is not to someone you know, not a family member or a friend, but just donating your kidney because there are thousands of people out there dying because they need one. Those people are incredibly rare. There are about 245 a year, and there were 28,000 kidney transplants last year. So it's really rare to be that kind of altruistic donor. There are reasons for that. Why? Well, has anyone in here been an altruistic kidney donor in that sense? I haven't. Have you? I mean, if you have, you would be the perfect person to hear from right now. Okay, so tell me some of your reasons. Why haven't you donated your kidney for free?
You might need it later.
You might need it. Okay, yeah. Studies suggest that probably either both of your kidneys will fail or neither of them will fail. So you probably won't need it later, but that's an idea. What else?
I'm guessing a lot of people just never thought about it.
Yeah,
That's
haven't thought about it?
No.
So maybe next week everyone's going to be gone. They're all going to be Actually, it takes a long time to donate your kidney. You won't be gone next week. Yes.
You're probably worried about like the effects of the surgery, like how that will leave you like feeling and looking maybe.
Yeah. So will you be disfigured? How painful will it be? How much suffering are you going to have? What else?
Helping a stranger often isn't a big enough incentive.
Okay. Yeah. I think that's true.
Donating kidney can be pessimistic because it's not very often that a kidney is accepted into the other person's body. There's 3 trial processes, so 3 rejection processes. My cousin just got a kidney transplant, and it was pretty miraculous that he made it through the last rejection process. So his kidney's been accepted into his body, but he had one previous that was rejected.
Yeah.
So I think, I don't know, for me, I think, oh, what if my kidney isn't accepted?
What if you donate a kidney and then it doesn't even work? Yeah. Yeah. I have a niece who has a donated kidney. She actually asked me for a kidney first. Have any of you been asked for a kidney? So yeah, my 8-year-old niece, very cute, came to me in my living room and said, "Auntie Angela, I just heard I've been accepted to the transplant program, and my parents said you're O positive and I'm O positive. Would you donate your kidney to me?" And just so you know, my answer was yes. I didn't get to. Her Sunday school teacher got ahead of me. And so her Sunday school teacher gave her kidney, and Evie, and 7 years later, she's doing super well. So it definitely worked in her case. Any other reasons you haven't donated a kidney? No. So none of us have been altruistic donors, just willing to donate our kidney for no compensation. So then we have these questions about compensation, and are you still altruistic if you donate your kidney, if you get some sort of compensation for it? Does compensation take the gift away? So for this, I have a story. I think it's helpful to explore. Suppose there's a doctor, okay, and you're playing in the park, and you fall and you twist your ankle. And there's a doctor who just happens to be at the park when you twist your ankle, and you're all worried. What about your lacrosse career? What's going to happen? Are you going to need surgery? And he comes over, he explains his medical credentials, and he takes a look at your ankle, and he says, "You know what? Just go home and put ice on it. It's going to be fine." And so you limp home feeling better because he's reassured you. You put ice on it, and you skip the visit to the doctor. So in that case, his advice was free, right? You got it for free. So it was pretty nice of him. We might say, oh, that was altruistic. But what if when you're at the park and you fall and twist your ankle, what if the doctor's not there? That same exact doctor instead is at the clinic the next day, and as your ankle keeps swelling and you're worrying about lacrosse, what do? You go see him at the clinic, and basically, same thing as in the park scenario. He looks at your ankle, he says, it's going to be okay. Actually, I just want you to ice it. It's going to be fine. Go home. And so then on your way out, you pay the fee. Does that tell you, just those facts, does that tell you he's not a morally excellent person? Of course not. No, in fact, that, of course, is how he makes his living, and that people couldn't afford to get the training they need, right? If we didn't pay them. So we think it's fine for a doctor to get paid. We think it's fine for a babysitter to get, raise your hand. Do you think it's okay for a babysitter to get paid? Nannies? How about foster parents? Foster parents get paid? Yeah, they get paid. Often they just couldn't do what they do without payment. One thing that I think is really interesting, so I like to study kidneys and surrogacy together. What about surrogacy? If you get paid for carrying a baby for infertile people, does that have bearing on your moral excellence? So there are different options here when we talk about compensation. You can have kind of a weak minimal compensation where it's kind of the bare expenses very strictly construed, or you can have kind of a really generous compensation where we're thinking of expenses super broadly: childcare, lost wages replaced, all the travel, and of course any surgery that's necessary or whatever. What do you think? So with our questions I put over here, definitely giving someone a kidney relieves suffering, and bearing a child for an infertile couple, that relieves suffering. This question, is it still altruism if there's compensation? It doesn't mean it's not altruistic. I mean, I guess, can you think of a situation in which the doctor giving you advice at the clinic, it doesn't have to be altruistic, right? Like, if it's just the every 10 minutes appointments, he doesn't really care about you, but he knows the right answer because he's seen this ankle situation before. He tells you the right answer. It's not necessarily morally excellent for him to do that, right? Maybe neutral. So it could just be neutral. It's not really a gift he's giving you at all. But I think it could be a gift, like in the same clinic, the same advice, but kind of, do you think? Could it be altruism? Yeah.
I think like compensation is usually like compensating for the time and effort that you took out of tending to your own needs and you're tending to someone else's needs. It's not necessarily like negating that you are helping people.
Yeah. Yes.
I think that has a lot more to do with how you do what you do instead of exactly what you do, so the intent behind the doing.
Yeah, the intent behind it.
I think they're like, the action in the park I would say is altruistic, but the action in the clinic, I wouldn't go to the exact opposite and say it's, unaltruistic. I would say it's just an action that doesn't have any moral worth. That doesn't make it a bad action, it just doesn't make it a good action.
So do you think it definitely is neutral, like it couldn't be altruistic?
Being in the clinic,
Yeah.
well, it depends where the clinic's located. You could do a clinic in a third world country and get paid way less than you could in the United States. In that sense, I think you're doing something altruistic. But the park example, I don't know if that had enough details.
Yeah. Okay.
I mean, I guess it probably has a lot to do with intent. Maybe if you could take the doctor to a possible world where they get paid nothing and they would still do it when they're in the clinic, then they are altruistic. And if they're just there to make money, then they're not.
Okay, so our intent people are not sounding very utilitarian. They're not judging by the consequences, but by the intent. Let's see, there's somebody back here.
Well, I think part of it is just the opportunity cost, where if someone could go and profit much more and is making a decision to make less in order to perform the same service, I think that, to me, that's more of an altruistic act, where it's deliberately turning away from it, which I think is an interesting distinction between compensation and market, is that if you're being compensated for something, if you had a market paying you, it would probably be substantially more, or at least there's a profit factored in rather than just covering costs.
Yeah, so if we say this is kind of like $1 sign or maybe $2 signs, over here, potentially, depending what it is you're selling, valuable medical expertise, or that women who sell their eggs get paid more if they have high SAT scores and if they're tall. So if you're tall, if you're on an athletics team and you're at an Ivy League school, your eggs will command thousands of dollars more than another woman. Physical attractiveness means your eggs will be worth more. Yes.
Do they do the same thing with sperm?
Yes, men who aren't of a certain height or who have the wrong hair color will be rejected, not acceptable at all as sperm donors. And of course, ethnicity matters because some ethnicities the socioeconomic facts of life in America today mean that some ethnicities are more able to pay for these services. And so there are a lot of factors that you can't control that determine how much you would get paid. So depending what you have to offer, do you have that really rare kidney type? Some are much rarer than others, and a good match makes a difference. But yes, if you're a surrogate, have you already successfully had several healthy children? That, of course, going to a reputable surrogacy clinic is going to cost a lot more. So, but back to the altruism question, is your altruism less the more money you get here? Do you think that's true or just possibly true? Like, is it necessarily true or possibly true? What do you think?
I don't think it really matters how much you take, I guess, as long as like you would do it if you weren't given anything. Because if someone says, oh, we'll give you $10 if you came in today, I said, no, I want $5. That doesn't make my action better.
So if you're the doctor looking at the ankle and you could get $20,000, well, no one would pay that. So let's see. But like if you could just get 50 or you could get 200, you're saying it could still be just as much of a gift.
Yeah, I guess you have to consider where you're taking the money from. If it's from someone who can't afford it, then obviously that subtracts. But let's say it's from a corporation that sells your eggs or something, then how much you take might not matter as much.
Yeah, so it's interesting to think about. Is there a certain amount of money you could charge, or does it depend who you're selling to? Does it take away the gift part of it? But our time is fleeing, so let's go on. I put this under deontology, but again, I'm sure other people would ask this question as well. But Kant was concerned with questions like this. Is it moral? Interestingly, of course, kidney transplantation or selling eggs and semen, that was not possible in Kant's day. But he was very interested. He actually wrote about this topic in that people would they would sell their teeth to wealthier people. He said that was morally wrong. He writes about bodily mutilation. He was really against it. He was concerned about, at the time there were people called castrati, men who were modified so that they could sing higher, and he thought that was just wrong, you're mutilating your body. No one mentioned this when we were talking about kidneys, but what do you think? Do you think it could be wrong because you're mutilating your body? I mean, we talked about the worry of how you'll look, but I think that's a different question. Kind of the worry about will you be pleased with your own aesthetics is this different question than is this bodily mutilation? Is this something you have to account to Heavenly Father for? What do you think? Is that something to worry about? Yes.
Well, I think it's very different from teeth or changing your voice because you're saving somebody's life.
Yeah, so you're doing it for a good reason.
Yeah, and even though your lifestyle may change, the sacrifice, like it's the most Christ-like thing. Otherwise, like a guy who's changing his voice, it's more for personal benefit.
Yeah, so we're kind of back to intent there. I mean, it's interesting to look at the various things that are sold. I mean, I guess hair is just cosmetic, but you can argue that cosmetics matter. I mean, cancer patients buy wigs, they're expensive. I mean, why does everybody donate their locks of love hair, right? It's because we think cosmetics matter sometimes. But a lot of these things that are life-saving or that help infertile people have a baby, you can say, well, the reason I'm doing it is for this important purpose. One way that some people break this up is to say, well, it's okay if it's renewable. Most of these things are renewable. You can grow more hair, you can produce more breast milk, more. I mean, assuming you're the right gender, you can produce more semen, blood, platelets, plasma, even bone marrow. It takes a while, but you can renew your bone marrow. But the big outliers here are at the bottom. Well, actually, no, I guess we have to take out the liver look because you donate a portion of your liver and it slowly grows back. So we'll call that renewable too. But kidneys get left because you won't get another kidney. You're giving it away. So some people think, yeah, if it's renewable, it's okay. But if you're just getting rid of this part of your body, it's not yours to sell. That's been a worry for some people. Well, so this is a good interlude to talk about what are our church positions on these things. I haven't read anywhere where they talk about hair or breast milk. How about semen? What do they say? Do you know?
They discourage it.
Yes, you're strongly discouraged from donating your semen. They haven't made a statement about eggs. I've been told this is because semen has been possible to donate for a long time. Eggs are more relatively recent, so it's likely just the case the policies have not caught up. It's thought to be the reason. Who do you know who's high up in the church who donated blood plasma during college? President Nelson during medical school and his wife both donated blood plasma, so it's an interesting example. What about organs? What do they say about donating your kidney? Okay, I brought it. Organ and tissue donations and transplant. Now, one thing that's tricky about this is I notice it doesn't mention the dead versus living donor thing. So maybe you could argue. But it says the donation of organs and tissues is a selfless act that often results in great benefit to individuals with medical conditions. And then it's specifically talking about dead people, and it says the decision to will or donate one's body or organs or tissue for medical purposes, the decision to authorize the transplant of organs or tissues from a deceased family member is made by the individual or the deceased member's family. And then it has a paragraph for recipients, because on a lot of these things, we need to think both about the giver and the receiver, right? So if you're a surrogate, you have to ask, if you're the person employing a surrogate, is that a moral thing to do? And if you're the person who wants to serve as a surrogate, is it moral to be a surrogate? So you have to look at both sides of it. About organs, they say that a decision to receive a donated organ should be made after receiving competent medical counsel and confirmation through prayer. So this isn't quite as explicit as we might like about the living donor situation, but I take it the idea is it's not a mutilation, and if it, certainly it would be acceptable for you to accept an organ if you prayed about it and felt that it was right. It suggests to me also you could donate one if it's safe. Yes.
So do you know why they're discouraging them from donating semen? Because to me it's like families are so important that if there's a way for an infertile couple to create their own family, why does it matter if it's from someone else?
Yeah, I think that's a really good question. And of course, one possible reason, and of course you could look at, and I wondered, one difference, why is semen specifically mentioned as discouraged and eggs aren't mentioned? For a while I wondered if it was because of the masturbation thing. Obviously, men are not supposed to masturbate, and masturbation is the only way you can donate semen. So I wondered if it was that reason, but I was told no, it's probably just a historical accident, so it's eggs and semen. So one thing that's interesting is these policies, you can look them up, they're public, everyone can read them. Just go to Church of Jesus Christ, or whatever is the URL that replaces LDS.org. Go to churchofjesuschrist.org, I think it is, and just search Handbook 2, and it's the very last 2 chapters in Handbook 2. This is a handbook. It says specifically it's a guide for members of ward and state councils. So what's interesting about this is that on a lot of these moral questions, like here's sperm donation, it's a single line. It says, the church strongly discourages the donation of sperm. This is super interesting to compare with other churches. For example, the Catholic Church, which has a lot of medical ethics positions. They publish volumes and volumes. You know, the Pope will put out an encyclical. There's Evangelium Vitae. It talks all about, you know, all the medical ethics thoughts. In our church, it's very different. They don't give us pages and pages of explanation, so faithful members are left with the position and the opportunity, especially if you're a philosopher or interested in philosophy, to say, why is it? So we just have a few minutes left. Why do you think it might not be right to donate sperm or eggs? Yeah. Did you?
I think that from what I've seen, there's comments on like all things related to like surrogacy and all of that, and the overarching principle is pray about it, you know, it's up to you, but strongly discourage anything that's not the husband's sperm and the wife's egg. But like any other combination than that is discouraged.
Yes, I think that's exactly accurate. And why would that make a difference? Yes.
Well, I kind of want to mention like adoption. Like you can.
Yeah, well, we've got to say adoption here, right? Because it can seem odd if we're saying, well, no, we're not going to do the sperm and eggs thing, but then we are a church that obviously celebrates adoption. So we have to talk about adoption. Did you have more to say on that?
No.
Yeah. No, you're totally right. And we're out of time, so I will make the last comment really, really fast. This is a huge issue. We're against abortion, and yet our church accepts in vitro fertilization as long as you're using the husband's sperm. I suspect the reason, when you want to contrast these positions, what's the difference between adoption and, say, surrogacy? What's the difference between adoption and donating sperm and eggs? Here's my opinion, so label it such. But my opinion is the reason that it's different is because adoption is specifically for the child. This is something that's already happened. A child has been conceived, and its parents are either not willing or not able to care for it. And so adoption is something we do to step in and take care of the child. These other things, while it's super true that infertility is a problem and we don't want anyone to suffer that way, we can't do all the things we want. You can't do an immoral thing to relieve suffering, right? So surrogacy and egg and sperm donation are things adults do to solve that problem. And I think it comes down to genetic identity. Anonymous sperm donation used to be possible. Today it's not. I mean, if you're of Caucasian heritage, it's really, really easy to figure out who donated that sperm. And today donor-conceived children are figuring that out. Now, what we've seen in countries most countries other than the United States, no, I should say many, they think genetic identity is a big deal, and so they reject anonymous donation. Now it won't exist at all. But as we've seen other countries do this, we've seen donations plummet. People aren't willing to donate their gametes if people are going to know who it is. We're soon going to be facing that crisis as people come to realize that your sperm and eggs are identifiable as still you. I think, of course, that's true with adoption as well. We can do your DNA and figure out who gave you for adoption. But I think it's the difference of, are we creating a child whose genetic identity and questions of our identity are going to be difficult on purpose? Or are we stepping in to relieve a problem? That's my opinion. I'd love to hear yours, so come talk to me. Thanks.
Thanks once again for attending. We'll see you next week.